Well, David, so far you've done a perfect job of explaining the program. The Netflix model is really what we are. As David mentioned, it's a small monthly fee. We cover 805 drugs. It's the top 90% drugs in America. These are the most utilized drugs that people are actually taking. So these aren't loss leaders or, drugs that, people are not taking. This is what the everyday American is taking. The program is very simple, just as David has alluded to and shown you all. There's five categories once you become a member. The acute medication, immediate need. The perfect example is you have the flu. You go to the doctor. What happens 10 out of 10 times? You drive straight back to the retail pharmacy that you've always been going to because the doc wrote you a script for an antibiotic and you don't have time to wait. You want to zap that flu out of your system. So you take our membership card in 64,000 pharmacies in America. It doesn't matter if it's Walgreens, Rite Aid, CVS, your grocery store, a mom and pop pharmacy. We're accepted at every pharmacy in America. You present our card and you're getting that acute medication for free. And acute medication is just, like I mentioned, it's something that's short and quick. Usually lasts anywhere from 5 days to 21 days. Anything over 21 days then becomes a chronic situation. So antidepressants, heart medication, stuff like that. That's what we ship to the member free, next day delivery into your mailbox. That's important. A lot of people are concerned with, like the Amazon drivers or UPS, they're flinging their packages, on your front porch or next to your garage, and you might be concerned that somebody swipes your package. Well, obviously, it's a federal offense if somebody goes in your mailbox. So it's nice, safe, and secure. You're getting your medication. We deliver you the chronic medications in a 90-day supply, so 3 months. Usually, if you're a chronic user, you're getting your medication at a 30-day supply. So giving you a 90 days is quite a significant jump. At day 70, we know in our facility of day 70 of your cycle of your chronic medication, we start to reach out to you 3 times via text message and say, hey, David, it's day 70. Look like you're coming up for a refill. Would you like to get that? Yes or no? If you don't respond within 3 text messages, we actually have a live white coat pharmacist call you and go, hey, David, you didn't respond to our text messages. We just, want to make sure everything's okay and get your refill. Then it's coming to you next day. Usually the chronic medication is coming to you, within a 10 to 20 day lead time up until your next cycle. The third category, OTCs, top 30 OTCs in America. We actually have 10 of the top vitamins and minerals. We know that that's a very important in a health regimen of an American. We give these to the member at cost. So on our program, a bottle of Advil, a 500 count is $3.99. It's a tremendous savings and add-on for the member. The reason why these are not free is because, if we were giving away free Advil, people would be ordering 20,000 bottles and they'd have their own thriving Amazon business just selling our Advil. So it's just a little add-on for the member. The fourth category, diabetes, arguably the biggest category. So I like to paint this hypothetical picture. So for the small price for a family, let's say there's 100 people in the family and they're just paying that one small price, not per belly button, it's per door. So one small fee for the family, there's 100 people, and let's just say, unfortunately, all 100 people are diabetics. All 100 people that are recognized as a diabetic are going to get a free Lancet strip glucose monitor solution. Usually those starter kits can run anywhere from 50 to a couple $100. Now there's no reason not to test and manage your disease. Diabetes is actually a very manageable disease. What's unfortunate is they price it so out that people have to make decisions between rent, food, everyday household budgets, or even getting your testing supply for diabetes. And we just realized that it doesn't need to be that way. So we give the member no excuse not to test. So all the free diabetes testing kits, we give you the top 12 oral medications for diabetes for free, metformin, glipizide. There's a lot of tongue twister names, but there's 12 of them. Get those for free the entire time you're on the program. And we have the lowest costing vial of insulin in America at $19.95 per vial. And usually a diabetic is using several vials a month. I'm sure some of us saw several months ago, the government put a cap on insulin at $35. So believe it or not, we're actually coming underneath what the government did. So it's a tremendous savings there. The fifth category is pharmacy coaching. So we have 10 white coat pharmacists on staff at all times. Even though we're a quote unquote mail order facility, we like to act like your neighborhood pharmacist. A pharmacist is the top three most trusted profession. 9 out of 10 people go to a pharmacist before they even go to a doctor and ask the say to the pharmacist, hey, these are my symptoms. What should I do? All those good questions that you'd have for a pharmacist. We act the same way. You call us, you call our customer service department, they transfer you over to the pharmacist. You can ask them any question about drug interaction. Do I take this with or without food? But one of their big jobs is Easy RX transfer. So once you become a member and your scripts are at the Main Street Pharmacy right now, we reach out to you and we say, hey, David, you're a member of the program. We'd like to transfer your scripts over to the free program. Do we have your consent? You say yes. We show you the savings. And we do all of that laborious paperwork transferring your scripts from your current pharmacy over to us. They make that very laborious and difficult for a reason, because the retail pharmacies, they want to keep you as a member, but they're also gouging you. And now we're giving you your medication for free. I know this question will be asked, so I'll just address it now. Well, you said the top 90%. What about the next 10%? Those are brand and specialty medications. If you've ever seen a commercial, doesn't matter if you're watching a sporting event, a Hallmark movie, the news, it seems like drug commercials are everywhere. And actually, a fun fact is the United States is the only country that's legally allowed to advertise drugs, and you can't just go buy drugs. So think about that for a minute. You see a advertisement for Humira, but you can't just go to the store and buy Humira. Doesn't really make sense, but they do that for a reason. All those drugs are extremely, extremely expensive, and we have a solution for those. So we put members through what's called a patient assistance program. If you're one of those people that are on a specialty medication or a brand medication, our pharmacists do the paperwork for you. We get you eligible for a specific patient assistance program. 9 out of 10 times we can get that drug for at least 50% off, or in some cases we can actually get it for free. So a lot, like Humira, for example, is $5,000 a month. Nobody can afford $5,000 a month for a drug. That's just absolutely ridiculous. Now we have a solution for that. Not free, but if we can get you a greatly reduced price, it obviously helps. So that's really the program quickly in a nutshell. A little bit about us. We've been open since 2017. My father is the founder and CEO of the company. Way back in the day, he originated the concept of a discount card. So something like a GoodRx. 30, 40 years ago, those worked and they were great for the consumer. Now they're not worth the paper they're written on. They're just misleading the American consumer. They're advertising that a drug is $3. You walk in, next thing you know, the drug is $60, and you're left scratching your head going, well, I thought it was $3. And now you have to make that decision of, well, I need to get gas. I need to buy food. I need to pay rent, all the daily expenses. And I thought I was going to pay $3, and now it's an extra $57 that I just don't have, or I just don't want to pay. So then that becomes an abandoned script. And we see about 30 to 40% of prescriptions are abandoned at the retail pharmacy for a ton of reasons: access and cost. Now with this program, we eliminate both of those things. The cost is free. Obviously, you just pay the small membership fee. And now access. We joke around our office that the only thing we don't do is actually put the pill in the member's mouth. We pretty much do everything else. So delivering it, in your mailbox, you just sit back, relax, enjoy your day. Now you're getting your prescription meds for free delivered to your door. You're a happy, healthy customer, and you're saving a lot of money. So I'd like to answer any questions, or if there's any, areas of the program, David, that you'd like me to kind of expand on, I'm happy to do that.
Well, Avery, it's a pleasure meeting you, by the way. I've had great conversations with your father, and I'm glad you shared that he's your father. I know you share the same last name, so I didn't know if you were how you were related. But when I talked to your dad the first time, I could tell that there were the passion behind starting the company wasn't economic. I mean, I'm sure you want to do well financially, but he shared over and over the frustration he had about how much drugstores are making on
Mhm.
people and how
Yep.
much. Well, can you touch on that a little bit about what, when you just said they're gouging at the local, I thought CVS was giving me a price that the pharmaceutical company said, or I
Yeah.
thought Walgreens was giving me a price that the pharmaceutical company demanded. I didn't know
Yeah.
that they were marking that up. So can you just touch on why your dad started this company? And I know you mentioned it, but that spoke volumes to me when we decided to partner with you guys.
Yeah. So obviously that was a big reason why he went in and started this business. Cause like I mentioned, he was kind of an insider in the pharmacy industry the last 30, 40 years. And I see that there's a little over 200 people on this Zoom. And if I ask, who do you think controls the price of the drugs, the manufacturer or the pharmacy? I would bet 90% of you would say the manufacturer.
Mhm.
That's wrong. It's the retail pharmacy. We are all, so we're licensed, we're a pharmacy, we're licensed in all 50 states. So is CVS, Rite Aid, Walgreens, Publix, Albertsons, wherever you're located. I'm in Ohio, so if anybody's from Ohio, they're, Giant Eagle and, all the Ohio grocery stores. But we're all buying these drugs for 2, 3 cents on the dollar. CVS, Walgreens, and Rite Aid is buying that 2 cent pill and they're electing to sell it for 40, 50, 150, $200. Why? Number one, it's because they can. And number two, we're conditioned as pharmacy consumers. We just accept that that's the price. Has anybody noticed that pharmacy is one of the only products and industries that doesn't have number one, it doesn't have a set price list. You can't Google, what's the average price of this drug? And there's also no menu board. When you drive to McDonald's and Burger King, you know that a hamburger is going to cost you $1 or $2. If you take a prescription to a corner and there's a Walgreens, Rite Aid, CVS on all four corners, you're going to get a different price at every single pharmacy. CVS might be $40, Walgreens might be $50, Rite Aid might be $20. And they control what they sell it for, and they do that for a reason. So my father was just sick of that, sick of the games, sick of the end consumer, the American, being gouged. There's no reason why a 2 cent drug needs to go for several $100s. Our biggest therapeutic class is antipsychotics and behavioral health medication. These are that's a chronic medication. These are medications that people need to get through the day. And we all know mental health crisis going on, all the things going on in the world. Wouldn't you think that those people would get a break for their drugs and they'd be able to afford and get access to medications that they need every day? Duloxetine, one of the highest prescribed antipsychotics, if you're a cash paying consumer, it's $500 a month, 30-day supply. So do the math times 12. That's a lot of money. People just can't afford that. Now we completely wipe that out. People are getting that medication for free. They're happy, they're healthy, and they're getting it at a 90-day supply. So it's
That,
we
that I
don't.
mean, that
Yeah,
that
go
was
ahead.
eye-opening to me, Avery, when your father shared that with me, completely eye-opening because I thought it was the manufacturer. And
Mhm,
I love the pricing model you guys came up with because you guys created this
mhm.
Netflix model type thing. And I mean, that's why we've been able to fast track this, folks. Some of you know that we just started working with My Free Pharmacy in the last 3 weeks. We've been trying to put this together for months and we didn't even know about this organization. And I feel it's divine that we've been brought together, Avery. I'm real excited. Other
We
than
are
that,
too.
I'm a Michigan guy or an Ohio State guy. Other than that,
That-
your dad's Nebraska, I believe. So other
well,
than
I'm born and raised in Ohio, but I didn't go to Nebraska. The school I went to didn't have football, so I'm technically a Cornhusker. But
okay, how do you doing, Wade?
Hey, listen, this is oh man, I've been talking for a couple of months to places that I've already got set up, like doctors' offices, pharmacy offices, and all that that are and dentist offices that man, all I gotta do is put a QR code there and they're all on it. But the question I have for you, it's amazing to me what you can do with the insulin part because
mhm,
it has affected a lot of people in my family.
mhm.
And the one thing I want, and I'm assuming that you since you have all the package, the starter package, and all that they need. What about the insulin Oh, I just went blank. What is it? The shot, not the shot,
Pens.
what do you call it? Pens, the insulin
Yep.
pens.
Yeah, we have insulin pens. I believe our insulin pen, so our standard insulin that covers about 80 to 85% of diabetics is $19.99, but our pens are about $37. So
Okay.
still, if you're buying those pens, they're way more than that. They're in the hundreds of dollars. So $37 is a tremendous savings
Yeah.
for
It really is.
insulin.
Thank you, Wade. And by the
Thanks.
way, do you go directly to Walmart to get those? Is that correct?
That's correct. Yep. So we contracted with Walmart for all of our diabetes supply. So there's virtually a Walmart on every corner. So if you're diabetic and you need the insulin, you just go to Walmart to get it. We ship you the oral medication and the diabetes kit, but the insulin you go through Walmart.
Okay, fabulous.